हाँ हाँ ठीक है सर।
Good evening, everyone. A very warm and humble welcome to the webinar series under Youth and Adolescent Health. My name is Aliza Hassan and will be moderating today's session with my colleague Ms. Smita. As today we are holding our webinar on role of nutrition and its importance as it becomes our foremost duty to bring this subject into notice and aware more and more people. Let's start with a brief introduction about SHARP NGO. SHARP stands for School Health Annual Report Program, working from over 21 years in the field of holistic development and healthcare of students and children. We at SHARP always try to emphasize on the problems related to youth and adolescents during and after pandemic.
So it's been about 2 years since the world is grappling with this pandemic, and life has changed not just here in India but around the world. And wave after wave, variant after variant, the virus continues to evolve, and so as is our life. And it's transforming in ways that we couldn't have imagined, right? So in this webinar today, we would like to focus on the importance of nutrition and its role in these unprecedented times.
Nutrition is a critical part of health and development. Better nutrition is related to improved infant, child, and maternal health, stronger immune systems, safer pregnancy and childbirth, lower risk of non-communicable diseases such as diabetes and cardiovascular problems, and longevity. Healthy children learn better. The COVID-19 pandemic is expected to increase the risk of all forms of question. So before we start the round of discussion, here is a very beginning question to make our audience understand about from our professionals about nutrition, its intake, how important nutrition is in times of COVID-19, and what role does it play, because in these times it is very important to circulate the right information from the very authentic source. I would like all the panelists to please brief about the importance, its role, how it is important in these times. Any one of the panelists can start.
So, hi, I'm Anshu Mehra. I am a dietitian by profession. So, I guess this is the right question for me. Let me go ahead. We all
ma'am, can we be a little bit louder? Your voice is a little low, if possible.
Is this better?
Yeah, better, but if it can be increased, no problem, ma'am, you can go ahead.
So, I said my name is Anshu Mehra. I am a dietitian by profession. And I guess this question is very, very pertinent to me. And I would like to open this round. Coronavirus, like we know, is caused by SARS. And we know that people with weakened immune systems, like older people, very young children, people with long term chronic diseases like lung disease or cardiovascular disease, these people are more at risk. And we also hear that a well balanced diet can optimize the function of the immune system, improve the metabolism, and help prevent the development of chronic symptoms associated with COVID 19. So, the key word here is a balanced diet, and that is what I would like to focus on today, because there's so much in the media today about the diet, whether you should eat this, whether you should eat that. So, I would like to emphasize on the importance of balanced diet, and I would also like to tell you that there isn't a particular food this which could help you prevent coronavirus or uh, will reduce the symptoms per se.
Any of the panelists would like to add to what ma'am conveyed? Rita ma'am, would you like to add something?
Sure. Namaskar, everybody. Good to see you all. It's the digital technology is excellent, but it is very unfortunate that we cannot meet in person. This is a very important topic, what Sharp is going to present to many audience in India, including the children, the parents. So thanks for the invite to me. I'm a public health nutritionist, not a dietitian as such. So I'll be giving a macro perspective about nutrition and COVID. In addition to what my friend just told us, Anshu Mehra, I'll just focus on that nutrition is important even in the normal times. The good nutrition is very important for our health, as you just said, for development, not just for the children, but for adults, the elderly, the young, the girls, the boys. So it's very, and even for the young infants, the breastfeeding, as public health nutritionists, we promote that as well. So there are a lot of the issues which we have to keep it in mind, and more so in any time when we get sick, not just COVID as such, but any sickness. When we get sick, people have the tendency, oh, I'm sick, so I shouldn't eat. I shouldn't eat that. So there are a lot of myths and fads and beliefs in our culture or around the world that we should not do this and we should not do that. So I just want to just state that in COVID, there are few principles. It's not just nutrition. It's a given that we are all working from home. We are sitting, no exercise. So exercise is very important, physical exercise. It doesn't mean you have to go to a gym or you have to go for a whisk exercise, but just even walking the children just to play around, just walking in the house or doing little kind of whatever exercise they can do it. Good sleep is very important, and hydration, the water. In addition to nutrition, the water is very important. And I want to give this message to all the children, more so to the children, and especially in this weather when it's cold, we just forget ourselves. Oh, well, it's cold, I don't need to drink water. So at least 6 glasses of water, it's very, very important, along with good nutrition, good food, balanced diet. And of course, the exercise. And in addition, of course, masking, physical distancing, washing hands. It's not just the food which makes the problems, but it's the hygiene and sanitation and safety of food, which is very, very important, even in normal times. So I'm not just saying it's only for during the COVID, but even normal times, we need to make sure that we have this habit. And it's a blessing in disguise with this COVID that people have gotten into the habit of washing the hands maybe more often than we used to do. So washing hands, making sure that our food is safe, the vegetable, fruits, what we eat are washed well. So I'll just stop here to start with and maybe take more questions at some stage. Over.
Thank you so much, Ms. Rita and Ms. Anshu, for those opening comments. I guess before we get started with today's discussions, I just had a few instructions for our audience. We will first have a round of discussion with our panelists, and then we would be taking audience questions. Audience is requested to drop in their questions in the Q&A box. You can see the icon below on your screen. And we will be taking live questions. 2 best sharpest questions of the day will get gift vouchers worth ₹500. One small request to the audience from our side. We have seen it in the past. I know all of you are very excited, all the kids out there, and they want to learn more and know more, but try to keep the messages in the chat box to a minimum so we don't lose those important questions and messages coming up there. On that note, let's get started with introducing our panel for today.
All right, so I would like to welcome our very first panelist, Ms. Urvashi Prasad. She has extensive experience in health, nutrition, sanitation, gender, and public policy. For 5 years, Ms. Urvashi worked as a public policy specialist in the office of the Vice Chairman at Niti Aayog. Ms. Urvashi is a member of the task force for overseeing the implementation of Sustainable Development Goals in India and co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in 2017. She was also a director at Operation Asha, one of India's largest tuberculosis control NGOs. Ms. Urvashi has over 100 publications to her credit in leading national and international newspapers, journals, and digital platforms. She is the member of the World Economic Forum's Expert Network and an alumnus of the World Economic Forum's Global Sharpers community. We welcome you over the panel, ma'am. Over to you, Smitha.
I would like to introduce Ms. Anshu Mehra. She's a diet counselor at Blossoms Public School and also a freelance dietitian. She's also an associate professor at Merit College Faculty of Home Science. She is a founder of Salud by Anshu. She is a National Executive Council member of IAPA in India. Ms. Mehra is also a consultant in Global Medics. Moving on to our next panelist, Ms. Rita Bhatia. She's an international expert with extensive experience around the world in humanitarian crisis and development situations. Her focus has been on developing policies and strategies, program management, refugee health and nutrition, HIV, maternal and child nutrition. She's also worked on economic security and school meal programs and several nonprofit organizations as well as the United Nations. She's currently on the board of several NGOs, taking the lead in public health nutrition and food security evaluations around the world, while also mentoring young professionals in public health nutrition and humanitarian crisis. We start today's conversation with another question. Maybe we'll, okay, Aliza, you want to go ahead with the first question?
All right.
Yeah.
So we will have a direct question and answer round with our audience. So our first question is from Sonal Vatsya. Sonal, please unmute yourself and tell us where are you speaking from, and then followed by the question. Sonal, please unmute yourself. All right, so our next question is from Vyan Khanna. Vyan, please unmute yourself and tell us where are you speaking from. Vyan, are you able to speak?
Yes, ma'am. Good evening, ma'am.
Good evening.
I am from Surah School, Sector 56, Class 8th. I want to ask that what can we eat or what exercise can we do from protect ourselves from COVID?
Any of the panelists can take up this to answer.
So, Rita, there's no particular one food that you can eat to prevent coronavirus. We are talking about a balanced diet. So a balanced diet basically means that you have to have all the macronutrients and the micronutrients. So if we talk about the macronutrients, we are talking about proteins, we are talking about carbohydrates, we are talking about the fats. When we're talking about the micronutrients, we are talking about fruits and vegetables, the various minerals that you get from fruits and vegetables. We are also talking about nuts and oilseeds. So let me start. When we talk about proteins are very important because they help in growth of your body. And in coronavirus times, we're talking about protein in terms of immunity. So it helps you improve your immunity. So obviously you need to introduce protein-rich foods into your diet. So protein-rich foods would mean if you're a vegetarian, then it would mean your dals. If you're a non-vegetarian, it would
Ma'am, like chapati, dal, chicken, milk.
Chapati, beta, is a carbohydrate. Chapati would be a cereal which gives you carbohydrate. So protein-rich foods, if we are talking about, it would mean dals, chicken, milk products, dahi, your nuts and oil seeds. So these are the things which are important if we are talking about proteins. Then if we move on to carbohydrates, so carbohydrates give you energy. It is very important that you stay energetic and your body has enough energy to fight the infection. So we need the carbohydrate rich foods. We need good cereal, good sources, whole cereals we need. So we're talking about chapatis, we are talking about bajre ki roti, we are talking about other juaris and nachnis. So we're talking about all those things when we are talking about the cereals. Then if we move on to the fats, we need to talk about good fats that you need to consume, and we need to talk about the nuts and oil seeds, the walnuts, the almonds that you need to increase in your diet at present. And coming on to the micronutrients, the fruits and the vegetables. So basically the plant sources give you sufficient amount of micronutrients that help you fight the infection. So you really need to improve or increase the vegetables and fruits in your diets. And like Ritu ma'am said, it is very important to improve the hydration as well. So please remember winter months, like she said, try to increase your water intake. If you can't have water, try increasing the kara or the teas or the coffees slightly. I mean, coffees and teas, obviously, as children, you can't be having too much of it, but your juices, your soups, anything that would
Yes.
improve on the hydration. So a balanced diet basically means that you need to incorporate everything into your diet, and your plate, your my plate should have sufficient amount of protein. It should have half of your plate should be filled with fruits and vegetables, and there should be a chapati or a carbohydrate source to go with it.
So, ma'am,
So,
how much water can we drink in the day? 8 glass, 10 glass?
Yes, you can have 6 glasses minimum, and you can take it up. So the water
Okay, ma'am.
is calculated based on your weight, but I can safely say that you can have up to 8 glasses of water. The more you
Okay,
have,
ma'am.
the
Thank you.
better.
Thank you, ma'am.
so as a follow-up to what you just said, Ms. Anshu Mehra, I would like to ask Ms. Urvashi, as a mother myself, I see three distinct phases: pre and, pre-infection, during the infection, and post the COVID infection, right? So somewhat something is preventive, something is during an active infection, and you may not be able to eat that complete, perfect, balanced diet at all these three different phases, right? So my question there would be to Ms. Urvashi, what are the main types of foods we need to consume during these three phases, keeping in mind that, it might be difficult during an active infection to have that completely balanced food, and what is absolutely critical at that point, and what is absolutely critical in the recovery phase. Ms. Urvashi?
Yeah, right. So I think, already as the panelists have mentioned, I mean, there is no sort of special food per se for, this virus. I think a general, balanced diet which boosts your immunity at all times, that is ideal at all times, whether we are talking of, building immunity or fighting the infection. Now, of course, we understand that when we are sick, not just this with this virus, but any other, sort of illness also, it is often very difficult to, eat. You don't want to eat, you don't feel like eating certain types of things. So those challenges are there, but I think to, the extent possible, we have to still try and ensure that that certain bare minimum, level of nutrition and completeness of the diet is being followed. Also, was mentioned, some, hot fluid. So you might not, you might not be able to eat so much. You might be able to have a soup, or something like that. So there can be these kinds of modifications that we can make depending on, how somebody is feeling and how much they are able to, take in. But that basic balanced diet, having those main components of, proteins and carbohydrates, fruits, vegetables, to whatever extent we can, that is very important, because that is what would help build immunity, that will also help fight back from an infection. So that is very important. And I think one point I would like to add here, um, during the illness, it's a broader, it's a point away from nutrition, but it's a broader point, and it's actually quite linked in the health context. And this is something that, the government is trying to, put out guidelines. We're trying to work with doctors and others, but it's very important that people are also aware that unnecessarily taking a lot of medicines, which actually don't have any impact on this virus, because we have to remember that if you're taking an antibiotic, this is a viral infection. So antibiotics may be taken if, the doctor feels you have a secondary infection. That is a different situation. But if it is a simple viral infection, your symptoms are not, to that level, they are mild. There is no need really in most cases to, pump your body with extra medicines and antibiotics, because that makes it only harder for the body. And actually that might also make it harder for you to, feel like eating and things like that. So that is also a very important point. I know that, in a lot of cases, the doctors are actually prescribing these, medicines. And so we are working, at least from the government point of view, I can say we are working on that front. But people should also be aware that, don't unnecessarily take things which you don't actually need. And let your, body, your immune system do most of the job, as in most cases, your body will do just fine. So I think that is also an important point that, we should keep in mind.
Thank you so much, ma'am. Rita, ma'am, would you like to add something?
Sure. I would like to add some of the foods, even in general, we shouldn't be eating. We shouldn't take too much of salt. It is also not good for our health, and not too much of sugar. There is a tendency, I have seen my own family, when they go through this COVID, you sit at home, you want to eat junk food. So try to avoid the processed food because your appetite is not very good. So you want to try all kinds of food, chips bhi kha le, or namkeen bhi kha le, or chocolates bhi kha le. So especially for children, and even for adults. So try to avoid some of these harmful food, because processed foods have too much of salt and maybe too much of sugar. Another thing I would also, somebody just put it on antioxidants. They are very important for our diet. We don't have to go for very expensive foods. We can have simple foods like amla. Amla is one of the very cheap, easily available food in our Indian diet. It is very rich in vitamin C. People say apple keeps the doctor away. I will say one amla keeps all your and gives you very good immunity, even in general. I'm not just talking COVID. And I also want to just make it a point that when we talk about nuts, people say, oh, bhai, hame to badam khana hai, hame to kishmish khana hai. No, you can have simple nuts. You can have peanuts, you can have any type of seeds, which are whole seeds. And I would encourage, especially children, they avoid the green leafy vegetables. They are very, very important. And it doesn't have to be the special one. You can have the leaves of the radish, you can have the leaves of the carrots. All the vegetables which we buy do also have leaves, and we can either cook them or wash them very nicely, and we can eat. Another good food, or I would say a herb, I call them herbs: ginger, garlic, onions. These are also very good vegetables in our Indian kitchens, and they can also be used. I'm not saying in large quantity or as raw, but when we cook our meals, we can use that. Dairy products, milk, paneer, ghar ka paneer, eggs if people are eating, if they are non-vegetarian. And I would also like to mention that don't take very oily food also. Too much of fat is also not good. And try to avoid canned food. Canned food has too much of salt. when we say, oh, at COVID ke time, fresh food nahi mil raha hai, let's just go and buy the tin food. If you use tin food, make sure that you rinse it and wash it so you take out all the salt and the preservatives from it. And my other good tip is try to use home cooked food if you can. And during COVID, I saw if my family, if everybody got COVID, we couldn't cook or we had a lot of challenges. There are a lot of agencies or in our neighborhood, there are like home cooking food which was available. So try to not go for pizzas and hamburgers and Amazon food and Zomato food, but just try to choose your balanced food. And dals are very important. Pulses are very, very important. And try to avoid very white, the like refined maida and rice, white rice. If you can have whole grain foods, fiber is very important for our digestion, and also it builds a lot of strength to our body for that. So it is very important to have the fibrous food rather than just going for very refined samosas and pizzas and all these are. I'm not saying you should not eat at all, but try to not consume too much of these foods. So these are my additional comments. Over.
Thank you so much, ma'am. Most of it has been covered by Urvashi ma'am and Rita ma'am, but still I would like to pull up some wrapping words from you, ma'am. Anshu ma'am. So anything from your end? I'm not able to hear you out, ma'am.
Is better?
Yeah.
Yeah. So I would like to add to what Urvashi ma'am just said. She spoke about over medication. So I would also like to stress on over supplementation, which people have been doing lately. They have been hearing about vitamin D, about vitamin C, about zinc, which is helping with is working as antiviral and anti-inflammatory, and they are just popping those pills. So I've been reading a study which says that if you over medicate on these supplements, there isn't an there isn't a link that you would be able to avoid the disease or benefit from this if you are over supplementing. So it is very important again to have a optimal kind of diet. Optimal would mean that what is right for you at that point of time. If you're suffering from COVID, then the guidelines need to be followed. If you've recovered, then you need to take a diet which will help you get back on your feet faster, and a diet which will help you thereon, a diet which will help you build up your immunity and to fight the COVID-19 in because the waves keep on coming in. We have variants. We are having right now we have the Omicron, and God knows what is going to come in next. So I would like to give you one jingle. I would like to give you a word, Corona, and let's take C. C for me is care, and care is balanced diet for me. O is not eating over the counter junk. R means maintaining the regularity, seeing to the body rhythm, maintaining the routine, the sequence, the sleep, the exercise, everything, the regularity there. O would again mean not overeating or omitting the food. That is also important, that sometimes we try to omit the food. So it is important that you have three main meals and try to have three small meals in between or two meals. N for me stands for natural foods, fruits and vegetables. I would like to stress on because these are basically they help you with fighting the disease. And A, avoid salts and sugars. So it is very important that you have prescribed amount is around 5 grams per day of salt. So let's keep to that, and sugar as much as we can avoid. So avoid the junk, avoid the sugar, avoid the salt, have small meals, have maintain the rhythm, and take a balanced diet. So that is Corona for me.
Thank you so much, ma'am. This was wonderful. All right, so let's take our next question from Probir Kumar. Probir, please unmute yourself and tell us where you're speaking from, and then followed by the question. Probir, are you able to speak?
हेलो।
हाँ जी प्रवीर, आप कहाँ से बात कर रहे हैं?
मैं वैसे दिल्ली से बोल रहा हूँ और सबसे पहले मैं आपको, रीता भाटिया जी को, सीमिता लाहिरी जी और अंशु मेहरा जी को थैंक्स कहना चाह रहा हूँ कि उन्होंने हमें शार्प के माध्यम से अवसर दिया बात करने के लिए। अभी जो आपने टॉपिक बताया है इम्यून सिस्टम की मजबूती के लिए, हम कोरोना वॉरियर के रूप में पिछले 2020 से लगातार दिल्ली और देश भर में हम काम कर रहे हैं एज ए सोशल वर्कर, और हम ग्रास रूट लेवल पे काम कर रहे हैं। तो हमारा ये मानना है कि बैलेंस डाइट से इम्यून सिस्टम तो मजबूत होता है, जो कि सभी तरह की बीमारियों से केवल लड़ ही सकता है, परंतु अभी हमारा सामना विश्वव्यापी ऐसी वायरस से है, कोविड से है, जो कि पूरे वर्ल्ड लेवल पे है। और इस बात पर क्या आपके पास कोई पुख्ता प्रमाण है, कुछ पुख्ता डेटा है कि न्यूट्रिशन से कोविड से बचा जा सकता है? हालांकि पूरे वर्ल्ड में ऐसे बहुत सी कंट्रीज हैं जहां पर न्यूट्रिशन पे बहुत ज्यादा फोकस किया जाता है, पर वहां पर भी ये फैला है और उसकी चपेट में बहुत से लोग आए हैं। इंडिया के लेवल पे मैं आपसे रिक्वेस्ट करना चाह रहा हूँ, एक तो अब ये डाटा बताएं कि क्या पुख्ता प्रमाण है कि कोविड से इससे निजात पाई जा सकती है, हालांकि इम्यूनाइजेशन बहुत जरूरी है, और दूसरी जो सोशल डिस्टेंसिंग और इस तरह की साबुन से हाथ धोना, सैनिटाइजेशन वगैरह। तीसरी, कितने लोगों के पास हेल्थ केयर सिस्टम तक पहुंच बनी हुई है? प्लीज इस पे थोड़ा बताएं, क्योंकि हम लोग कोरोना वायरस के रूप में बहुत लोगों से इस तरह के सवालों का सामना करते हैं, और हम थैंक्स कह रहे हैं शार्प को, जिन्होंने बहुत इस तरह के पॉइंट्स पे बहुत अच्छा काम कर रहे हैं और आप लोगों से हमसे उत्तर दिलवाते हैं। प्लीज आंसर दीजिए।
कैन आई कम इन हियर? अभी जैसे आपने बोला प्रवीर जी,
जी,
फूड कैन नॉट प्रिवेंट और क्योर कोविड। ये मिथ है कि हम अगर ज्यादा खाना खा लेंगे, ज्यादा प्रोटीन खा लेंगे, तो जैसे कि आपने भी बोला कि जहाँ जहाँ बहुत बड़े बड़े मुल्कों में भी ऐसे ही नहीं है कि खाने की वजह से आप इसको बचा सकते हैं या इसको ट्रीट कर सकते हैं, लेकिन ये है कि अपने सिस्टम को, इम्यूनिटी को स्ट्रेंथन करने के लिए हम जरूर हमें गुड न्यूट्रिशन लेना है। एक तो ये बात मैं कहना
पर मैडम, ये तो गुड न्यूट्रिशन से हमारा इम्यून सिस्टम मजबूत होगा, जो कि सभी बीमारियों से तो हम केवल लड़ सकते हैं, है ना? पर हमारा ये सामने ऐसे वायरस से है जो बार बार अपने आप को चेंज कर रहा है, कभी कुछ, और अभी ये चलेगा, अभी ये आगे तक जाएगा। तो हम सिर्फ ये चाहना चाहिए, कोई आपके पास डेटा है पूरे वर्ल्ड लेवल के हिसाब से हो या फिर इंडिया के इसमें हो तो अच्छा रहेगा।
So I would like to bring in Ms. Urvashi there. I think, Pravi brings a very good point about how it has impacted the grassroots and, how it has put pressure probably even on a silent crisis of malnutrition. And we understand that dealing with this pandemic, at the grassroots, as we've heard a lot about technology playing a role and, portion tracker, helping rural communities and all that. Has it really reached the rural areas, and has it really been able to make that impact? If you could weigh in on that, Ms. Urvashi.
Yeah, sure. तो ये बहुत अहम सवाल है प्रवीर जी, पर जैसे आपने कहा कि डेटा, तो पहले तो मैं कहूँ कि न्यूट्रिशन बहुत सारा हमारे पास डेटा है, कोरोना वायरस से रिलेटेड स्पेसिफिकली हो ना हो, लेकिन कोई भी वायरल बीमारी, कोई भी बैक्टीरियल, कोई भी और बीमारी इंसान को होती है तो जो न्यूट्रिशन स्टेटस होता है उसका वो एक अहम रोल प्ले करता है। वो गारंटी नहीं करता कि आपको बीमारी नहीं होगी, वो गारंटी नहीं करता कि आप उससे जल्दी ठीक हो जाएंगे, क्योंकि और भी फैक्टर्स आ जाते हैं। अगर आपको और किसी की प्रकार की बीमारी है, जैसे अगर आपको डायबिटीज है, आपको कैंसर है, आपको किडनी की और बीमारी है, तो उसमें आपके और कॉम्प्लिकेशंस आ सकते हैं। तो सिर्फ न्यूट्रिशन एक फैक्टर नहीं है, लेकिन आपको वो एक फाउंडेशन देता है। आप जैसे देखें टीबी में अगर आप देख लें तो कितना हमारे पास कि टीबी और मेल न्यूट्रिशन का जो लिंक है, अगर आपका इम्यून सिस्टम वीक है, आपका न्यूट्रिशनल स्टेटस खराब है, आप काफी हद तक ज्यादा ससेप्टेबल हो जाते हैं कि आप ऐसी बीमारी पकड़ें, या अगर आप पकड़ें तो उससे लड़ने की आपकी क्षमता कम हो जाती है। तो न्यूट्रिशन इसमें कोई दो राय नहीं है कि बहुत अहम है, लेकिन वो एक कोई मैजिक बुलेट सोल्यूशन नहीं है। इसमें आपको प्रिवेंशन के लिए तो देखिए बहुत ही क्लियर है कि आपको अपने जो कोविड अप्रोप्रिएट बिहेवियर है वो सबसे आपके लिए बेहतरीन एक इंस्ट्रूमेंट है प्रिवेंशन के लिए। तो आपको जो सामाजिक दूरी बनानी है, आपको अपने हाथ की सफाई मेंटेन करनी है। किसी ने सवाल पूछा है कि हैंड सैनिटाइजर अच्छा होता है कि नहीं, वो जरूर, लेकिन अगर आप हाथ धो सकें तो वो सबसे बेहतर है। हैंड सैनिटाइजर उस समय के लिए है जब आप हाथ साबुन से, पानी से ना धो पाए, तो वो बहुत अहम है। और मास्क, मास्क आपका सबसे बड़ा हथियार है। चाहे आपको वैक्सीनेशन हुआ हो, वैक्सीनेशन क्या करता है कि आपको बहुत गंभीर बीमारी से बचाता है, लेकिन वैक्सीनेशन भी आपको बीमारी पकड़ने से नहीं गारंटी करता है कि आपको बीमारी पकड़ी नहीं जाएगी। वैक्सीनेशन ये कहता है कि आपको अगर हुई बीमारी तो आपको मोस्टली इतनी गंभीर बीमारी नहीं होगी। तो मास्क अभी भी सबसे बड़ा हथियार है। तो ये प्रिवेंशन के लिए तो ये चीजें बहुत इंपॉर्टेंट हैं कि आप ये बीमारी कैच ना करें। लेकिन अगर आपने ये बीमारी कैच कर ली तो अपने सिस्टम को मजबूत करने के लिए न्यूट्रिशन का भी एक बहुत अहम रोल होता है। उसका एक मात्र रोल नहीं होता, जैसे मैंने कहा और भी फैक्टर हैं उसमें, लेकिन न्यूट्रिशन बहुत ही अहम है। और इसमें हमारे पास बहुत सालों से वही मैंने कहा कि ये वायरस बेशक नया है, आपने सही बात बोली कि ये नया वायरस है, ये रोज बदल रहा है, नए नए म्यूटेशन हो रहे हैं, तो वो बिल्कुल सही है। लेकिन कोई भी वायरस हो, कोई भी बैक्टीरिया हो, अगर आपका इम्यून सिस्टम मजबूत है तो वो आपके चांसेस को बेहतर करता है कि आप इससे और बेटर तरीके से लड़ पाए या बेटर तरीके से सामना कर पाए। तो उस हद तक न्यूट्रिशन का बहुत अहम रोल है। और एक आखिरी छोटी बात मैं कहूंगी इसमें कि न्यूट्रिशन, आप जैसे सोशल वर्कर हैं, तो जो बैलेंस डाइट है उसका कोई एक डेफिनेशन नहीं है। हर एरिया में बैलेंस डाइट का अलग मीनिंग होगा, सबकी जो अफोर्डेबिलिटी है वो अलग है, सबके फूड प्रेफरेंसेस अलग हैं। तो उस लोकल एरिया में इस तरह की जागरूकता पैदा करना कि आपके पास जो मीन्स हैं, आपके पास जो आपके प्रेफरेंसेस हैं, उसमें से आप कैसे एक बैलेंस्ड डाइट ले सकते हैं, वो बहुत अहम है। क्योंकि हर कोई भारत में हम जानते हैं बहुत ही अलग अलग सोशियो इकोनॉमिक लेवल पे है, अलग अलग उनके डाइटरी प्रेफरेंसेस हैं। तो ये जैसा कि आपने कहा कि हम लोकल एरिया में कैसे इस बात को लेके जाएं, तो आपके जैसे जो लोग हैं, आपके जैसा काम करते हैं, और हमारे सिविल सोसाइटी है, एनजीओ है, सरकारें भी, बल्कि बहुत सिविल सोसाइटी पे बहुत ज्यादा उन्होंने भी रिलाई किया है समय पे कि इस तरह के मैसेजेस को आखिरी माइल तक कैसे लेके जाएं। तो वो बड़ा इम्पोर्टेंट है कि बैलेंस डाइट भी कोई एक यूनिवर्सल नहीं है, अलग अलग तरीके का है। और उसमें इन सब चीजों को फैक्टर करना कि किसी का प्रेफरेंस डाइटरी क्या है, किसी की अफोर्डेबिलिटी क्या है, वो बहुत अहम हो जाता है। जी, थैंक यू।
Wonderfully answered, ma'am. Over to you, Smita.
Yeah, thank you so much, Ms. Urvashi, for a very elaborate answer. We'll take the next audience question from Anurag Mishra. If you could unmute yourself.
Yes, ma'am. Good evening, everyone. First, I would like to tell that my name is Aparna. Actually, due to some mistake, this is my brother's name. And I would also like to thank you all for giving us an opportunity to speak over here. I have two questions, and my first question is that there are some physically challenged people and feeble old people who couldn't exercise, so they used to go out for sunlight and some fresh air. Now it is quite harmful for them to go out due to this pandemic. So, is there any suggestion you can give to maintain for them to maintain their health too?
Ms. Rita, if you want to take that question.
Sure. Yes, during the pandemic, not only the old or the young, nobody could go out. Our parks were closed where we used to go for even walks, you know. So, uske liye, we can also do a lot of things, what we call the mental exercises, especially people, somebody has even written those who are especially challenged or ये खासकर corona के time I'm mixing. Corona time, most of us are at home. We are with the family. So it is very good for us to keep each other engaged. आप कोई इंडोर गेम्स ले लीजिए, उनका मेंटल स्टिमुलेशन भी जो होगा उससे भी काफी सपोर्ट मिलेगा और खुशी मिलेगी उनको. जो आप धूप की बात कर रहे हैं, it also depends where you are living. For example, I am living in a flat. I'm not living. So what I do is I just go on my balcony. थोड़ी देर भी धूप आती है तो धूप लेने के लिए, and I just make walks in my balcony. और कोई चारा नहीं है, पार्क में नहीं जा सकते, नीचे नहीं जा सकते, so we have to find a way. And what Modi ji has promoted the yoga, which not only is the physical yoga, it's also spiritual, it's mental. तो ये काफी चीजें हैं हमारे कल्चर में, in our Indian culture, which we can practice. This is the time, because when I was working, I said, oh, I don't have a good excuse. I don't have time to do this. But now we are all at home. So we can engage with our young children, our grandchildren, our children, keep them busy. We be busy with them. My granddaughter learns how to make chapati now. She's only 6 years old. So that itself becomes an exercise. So by doing all these kind of things, we can be very innovative. We can have our mental support to our family, to ourselves. Listening to music for me is also a very good way of keeping myself engaged. तो ये काफी चीजें हैं जो अर्पणा जी आपने पूछा कि what else can we do? There are ways. I always say if there is a will, there is a way. If there is no will, there is no way. So we have to find a way. By imaginating. And what I saw in India, जैसे अभी उर्वशी मैडम ने बोला, the government has managed to reach the remotest areas to give digital messages. जिन लोगों के पास फोन नहीं थी उनको फोन दिए गए हैं गवर्नमेंट ने, क्या क्या चीजें. and it's very challenging in a country like India with so many people around the world in many remote places, but our technology has reached. अभी सबको ऑनलाइन टीचिंग हो रहा है, गवर्नमेंट स्कूल में भी ठीक है. बहुत लोग हैं जिनके पास हम नहीं पहुंच पा रहे, लेकिन हमारी सिविल सोसाइटी के लोग, हमारे एनजीओस के लोग. So there are many ways the government is trying their best to reach them out, to give them the awareness and to give them more knowledge, not just. And so this is an opportunity. Sometimes these difficult times become opportunity for us to seek more information and support each other. अभी मैं ऑनलाइन टीचिंग, मेरे काम वाले जो आते हैं उनके बच्चों को मैं करा देती हूँ, बिकॉज इन द गवर्नमेंट स्कूल्स they cannot go to school. इतना ज़्यादा क्वालिटी ऑफ एजुकेशन इज नॉट एज गुड एज इन द प्राइवेट. तो मैं उनको तो हर रोज 1 घंटा पढ़ा देती हूँ. Whatever it is, sometimes it's a story, sometimes they want to learn English. I'm not a professional teacher. और जैसे आज मैं आपको बता रही हूँ, सबको बच्चों को यहाँ पर खाने उसके बारे में भी बता देते हैं. So there are many ways for us to be more human and support our society, which is part of our culture. Over.
Thank you so much, ma'am.
Can I just supplement Rita ji's point?
Definitely, ma'am.
Yeah. So I just wanted to add that, like she mentioned, that mental health, because we are talking of COVID and कई बार हम लोग we are just talking of, बहुत से सवाल हैं कि physical health और mental health बहुत linked है, उसमें कोई doubt नहीं है. Physical exercise इसीलिए बहुत important है, लेकिन mental health जो कि pandemic अपने साथ इतनी अनसर्टेनिटी लाया है, लोगों में एक डर है, लोगों में एप्रीहेंशन है। साथ साथ इतने सारे लॉकडाउन्स हुए हैं जब हम लोग बाहर नहीं जा पाए, लोगों से मिल नहीं पाए हैं, तो जो भी हमारे जीने का एक तरीका था पूरी तरह से बदला है वो। और अभी भी ये डर नहीं गया है, जो कि जब भी हमें लगता है कि चलिए अब केस कम हो रहे हैं, फिर कोई नया वेरिएंट आता है, फिर ये है कि आगे पता नहीं क्या होगा, तो इसमें मेंटल हेल्थ बहुत सफर करी है। तो इसीलिए हमें मेंटल हेल्थ पे भी उतना ही ध्यान देना चाहिए। और जैसे रीटा जी ने कहा कि अब हमारे पास एक डिजिटल का चाहे इम्परफेक्ट सोल्यूशन है, लेकिन थोड़ा उसकी वजह से हम फिर भी कनेक्टेड रह सकते हैं। जैसे आज हम लोग जुड़ पा रहे हैं, हम लोग बात कर पा रहे हैं, चर्चा कर पा रहे हैं, जबकि हम लोग फिजिकली एक साथ नहीं हो सकते। तो जहां भी हम इस तरह से लोगों से कनेक्टेड रह पाए, अपने ही फैमिली मेंबर से कनेक्टेड रह पाए, वो बड़ा इम्पोर्टेंट है। क्योंकि बीमारी ये वैसे भी ऐसी है कि आपको थोड़ा आइसोलेट कर देती है, आपको बोला जाता है कि आप अलग रहिए, दूर रहिए, लेकिन वो सोशली एक वो कनेक्टेड रहना भी बहुत बहुत इम्पोर्टेंट है। क्योंकि वरना जो मेंटल हेल्थ है उसका हम देख रहे हैं कि बहुत ज्यादा बर्डन बढ़ रहा है। तो मैं कहूंगी कि एक्सरसाइज के बारे में सोचें, हेल्थ के बारे में सोचें, तो वो मेंटल फिजिकल दोनों डायमेंशंस को एक साथ एक साथ दोनों पे उतना ही ध्यान दें। थैंक यू।
Thank you so much. I think, we'll take the next question of Daivik Singh or Priyanka. Is that Priyanka for Miss Anshu? It's a diet related question. So I think, it would be good if you could answer that, Miss Anshu. Priyanka, if you can unmute. You're showing as Daivik Singh. Okay, guess she's left. Alisa, if you want to take the next question.
So our next question is from Pravesh. Pravesh, please unmute yourself and tell us where you're speaking from, and then followed by the question.
Looks like he left. So maybe, Alisa,
Yes.
if you can read out the question, it'll help,
Definitely. 1 second. So his question was how to motivate at large to do this, because some poor people have not much expenses and have not awareness regarding this, how they can do this. Is government doing something for them, like slum, poor people in villages and marginalized population?
So he's talking about nutrition in the
malnutrition
marginalized.
in India, yes.
Yeah.
Urvashi ma'am, would you like to take up this?
Yeah, sure. So I think, as I was touching upon, in an earlier response also, that nutrition, this is part of the challenge that we have, that, everybody is not at the same level in terms of affordability, in terms of access. And also there are differences in terms of preferences, dietary preferences, also differ across the country. So given this, and given the fact that though the government, central government, state governments, they made their best efforts that services, should not really be disrupted, we did end up seeing some amount of disruptions. I think that was almost inevitable given the scale and, diversity of the country. So these two things coupled together have obviously made it even more challenging. And so I think one, of course, the government is doing a lot of initiatives and is trying to restore, the services, that the regular services that have been disrupted. But as I said, that, governments, it's very difficult for them, to always be everywhere. And especially when you're in the middle of fighting such a big pandemic, a lot of your resources get diverted towards that. A lot of your frontline workers, their time is being used up in actually, doing direct sort of mitigation of the pandemic, contact tracing at the earlier stages. We had a lot of our frontline workers involved in that. So they might not have been able to do what they normally do. And so that did result in disruptions. And that is why I mentioned that, working with the civil society organizations, working with local volunteer groups, we have seen a lot of volunteer groups come forward at this time, a lot of young people, a lot of students, a lot of resident welfare associations have stepped in. So ultimately, it has to be a combined effort of the government with all these stakeholders to make sure that we reach that last person. It is not easy. It is a big challenge. It is very difficult. But we have to build on this network because ultimately we need a localized approach. As I said, that what sitting in Delhi, what I might be able to eat, obviously somebody sitting in a remote tribal area, they will be in a very different situation. So the solutions also have to be localized. We can't have a one size, fits all. And the best way to implement that localized solution is to work with the local organizations, civil society, the local, stakeholders, and really combine that with the efforts of the government. So that is the approach that, we are trying to follow. And I think most of the state governments are also trying to follow this approach. So role of individuals, civil society, volunteers is equally critical at this time if we have to reach that last mile effectively. Thank you.
Thank you so much, Ms. Urvashi, for highlighting that, everybody in our society has a role to play. I think everybody here will agree. Our next question is to Ms. Anshu Sharma.
I think Rita, ma'am, you raise your hand. Would you like to add something?
Yeah, I just wanted to compliment what Urvashi Madam has just said about a lot of the schemes in India, the Universal Integrated Child Development Program, education, whatnot. This is the country where billions of people are being supported. And as she said, government cannot reach everybody. So the role of, and I work with a lot of those frontline NGOs as a technical person, and I do go to tribal areas. So I fully agree with what ma'am said. The point I want to say is, I always said, being a nutritionist, there is no magic bullet for nutrition. अगर किसी को measles है, किसी को polio है, उसके लिए हमारे vaccinations हैं. But nutrition is very complex. It's not just about food. उसके लिए whole environment is there. We need safe water, we need wash facilities, we need health, we need nutrition, we need agriculture, we need education. बड़े लोग हैं, बड़े लोगों के पास पैसा भी है, उसके बावजूद भी हम देखते हैं they still have nutrition issues. So that is why when people say, well, in India, why do we have so many children who are malnourished? It is not a simple answer for nutrition. And if a nutritionist can only give you an advice, but as Urvashi ma'am said, affordability, the poverties, there are a lot of manifestation, a lot of causes of these undernutrition in India. तो उसके लिए भी लोगों को समझना चाहिए कि गवर्नमेंट अगर आपको पीरियड्स में या जहाँ भी जो फूड उसको सप्लीमेंट करना पड़ता है और affordability is a big issue. That is why we are seeing a lot of concerns in our country. And in tribal areas, there are a lot of lack of education especially among the mothers and even fathers. And there are a lot of beliefs हमारे culture में. हमारे culture हर जगह है. So we have so many beliefs. ये नहीं खाना, वो नहीं खाना, बीमार है तो बच्चे को ये नहीं देना. So all these things is a mindset of people also. So even among the educated lot, I have seen, no, don't do this, don't do that. So these kind of things also are part of the package where we try to influence our frontline workers. And we have thousands and millions of those Anganwadi workers, जहाँ वो volunteers हैं करते हैं. तो मैं ये बस ये कहना चाहती थी, there is no magic bullet for nutrition कि हम magic वो bullet को tablet को खा लेंगे तो हम healthy रहेंगे. वो ऐसा नहीं हो सकता है. So that is just a point I wanted to mention. Thank you.
Would you like to add something, Anshu ma'am? All right.
So I had a follow-up question. I know, we've touched upon it in bits and pieces through the conversation today, but I would like to come back to Ms. Anshu there. and ask, we have like age-old dadi ke nuske, dadima ke nuske, kadas, and all these other do's and don'ts, and eat this and don't eat this, traditional household recipes, etc. So, what are your thoughts on on traditional Indian nutrition and the nuskas that we often hear at home?
90% of the spices that are being used in our kitchen have.
Ma'am, if you could just speak up a little louder, your voice is very feeble.
I said 90% of the spices that are there in our kitchen have some kind of antiviral properties. So, if you hear that जिंजर ले लो हनी के साथ, या टर्मरिक का काढ़ा बना लो, या तुलसी, गिलोय, all these herbs that we are using really have an impact. I mean, like Ritu ma'am just said, there's no magic bullet as such. There isn't a singular food that you can eat and you can just forget about corona. ऐसा नहीं है. But definitely, when you eat these herbs, when you take these infusions, when you drink these kadhas, it does help you build up your immunity. Again, I would like to specify that immunity cannot be built in one single day. It is a long drawn process. It will take months maybe. एक दिन एक आंवला खा लेने से does not really help. It has to be a long drawn process. So, I have also been reading a research paper where a lot of work is being done on harsingar. If you know the flower, it's a white flower with a pink little stem and generally comes around Navratras. That is the flower I'm talking about, harsingar, very sweet smelling flower. So, a lot of research is being done around that, and they are talking about it in being an auxiliary kind of stuff. And also Baba Ramdev, we've all seen how he has popularized Giloy. Giloy again does have antiviral properties, and it was used in age-old times for prevention of viral infections and flu and stuff like that. So it's been taken ahead, and like I said, it will not help prevent, maybe it will help reduce the severity of the disease, but there's no harm in using these spices, and we should continue using these dadi ke nuske as we call it, and it does help, especially with the cold, the congestion. Drinking a hot cup of kada or a hot cup of infused tulsi tea, it's very good and it does help.
Thank you so much, ma'am. So
Hello.
let's move to, yes.
Good afternoon. Good evening, ma'am.
Good evening.
Ma'am, I am Arushi from Suraj School Sector 56.
All right, Arushi.
Ma'am, I have a doubt. What do I do if I get a rash or other reaction to hand sanitizer?
Can you please pardon?
Okay, ma'am. What do I do if I get a rash or other reaction to hand sanitizer?
I think it's very simple. Don't use it. It's also the quality of sanitizer. There are so many sanitizers, especially during the COVID. It was so much of demand that everybody started producing it. So my suggestion is sanitizers are not the best. We only use it when we are not in the house. But I think washing hands with soap, but properly washing is the best answer. So don't go for sanitizers unless you have to. But if you are using it, don't use any kind of cheap, because there are many kinds of, so go for a quality one. Otherwise, just don't use it. That's what I will advise. Keep water with you in a bottle if you cannot carry a soap. I always carry a little soap in my bag, and bottle of water to hota hi hai. So agar aur kuch nahi milta, so I'm also not allergic to sanitizers, but I hate these kind of, how do you call it, synthetic products. So try to avoid. And just on that, I would give you an example of a friend of mine. She's a hairdresser. German ki hai wo, main jab rehti thi bahar, so she used to say, never wash your hair with shampoo. वो तो बोलती थी, don't even wash your hair with any soap or anything, just with water. Which I don't believe. I didn't believe her. So मैं shampoo नहीं, मैंने छोड़ दिया shampoo लगाना, because there are so many things in that. So if you could just have a normal, simple ways of life and simple things, I think you can protect yourself from many, many things.
Thank you so much. Okay, let's follow to
Hi, this
move
is
forward.
Arun.
Okay, yeah, Arun, please tell us where you're speaking from and then followed by the question.
Yes, my name is Arun. I reside in Mumbai and I'm 41 years. Actually, I had COVID around, say, 2 years ago. And that time I was having little brain fogging and, feeling low on energy. So I started using multivitamins, Supradin, and also Osta calcium, which is D3 inclusive. So I started feeling better after that. So just wanted to know, I'm gaining a lot of weight. I'm also a food blogger. So wanted to understand, is it because of the supplements, or what should I do? Or because I'm also working from home, I'm getting a lot of weight, almost like 10 kgs in 3 months.
Miss Anshu, you want to take that?
You're on mute, ma'am. I'm not able to hear you, ma'am. A little bit louder, please.
So I think the problem here is not the supplement. Probably it is the lifestyle that you are following right now. Probably you've stopped your exercises since you're probably not moving out now. And since you are at home, probably your diet has changed, your eating pattern has changed. So we really need to look into the whole pattern to decide whether there's a calorie excess here which is causing the weight gain, which probably will be the case when we study your case. And it definitely won't be because of the supplements that you're taking.
Okay, I just got worried because I'm gaining like almost 10 kgs in 3 months. So
No, you need to really sit back and think about your lifestyle, the changes that have happened in last 2 years, and you will see it very clearly. Otherwise, you can get in touch with one of the dietitians in your area and you can work it out with her.
thank you, Vatan. Thanks, Vatan.
All right. There's one question from Devik, that how to motivate young children to get green veggies eaten during this crucial time, as they crave more for junk. It's tough to make them eat healthy and channelize their energies. So because we have a lot of audience as a students, there are a lot of students who are participating in this webinar. So I would like to take up this question because it's important for them to understand that yummy food can also be prepared in the kitchen, and let's not move towards the junk and the temptations they offer in the market. So Anshu ma'am, would you like to take this up?
So the first point that I would like to bring across here is that it is very important for the parents to be the role models. It is very important that they themselves eat the green veggies and they eat the fruits, and it is taken up as a tradition in the house. And if it's a tradition in the house, then I'm sure the children follow suit. Having said that, there are ways to basically, if I can use, disguise the fruits and vegetables and give it to the children. Something like a green leafy vegetable can be turned into a paratha, can be kneaded into the dough, or can be put into the soups or the smoothies, and can be given to the child. It needn't be in the form of boring vegetables which the child learns to reject. So basically, fruits and vegetables are very, very important. You have to understand that these protect you from diseases. These help you with your immunity. So it is very important to eat. You should be having anywhere between 3 to 5 servings of fruits and vegetables. So I know it sounds very daunting, eating an apple or eating anar or eating the green leafy vegetable. But believe me, the more colorful your plate, the better chances there are. We call it a rainbow of colors. So if you are eating a rainbow of colors and if you have that kind of color on your plate, there are chances that you'll be healthier, you'll be like Urvashi ma'am pointed out, your mental health will be better and you'll be performing better in your school if we talk about normal days, if we don't talk about the corona per se. So please eat your fruits and vegetables. अगर ये सोच के खाना पड़े कि दवाई खा रहे हो तो भी I would suggest that you eat it. Please eat your greens, please eat your fruits, please eat your vegetables.
Thank you
Yes,
so
Rita,
much,
ma'am.
Yeah, thank you so much, Ms. Anshu. I think we'll take the next question from
1
Pepino.
second, Rita ma'am has raised the hand. Rita ma'am,
Okay,
please.
Sorry. No, I just want to compliment what Anshu madam said. It's very interesting because we all have children and grandchildren around us. Yes, we have to disguise them. I agree. And I always tell them, aapko dekhne mein kya color achhe lagte hain? They like red, they like orange, they like green. So that is another way of creating awareness. During the lockdown, most of the children were so busy on the computer because of their classes. So what I tried to do was cut some carrots in pieces. Agar aap unko puri carrot de doge, wo nahi khayenge. So I'll just put it next to them. And they're so busy with their class, they will eat whatever you give them. So there are ways, this is where parents and caretakers do come in. Unke piche nahi jaiye, but just find a way to change their habits and make it tasty and presentable. As Anshu madam said, like a rainbow color, and they like these kind of things. Or make something like a smiley, uske upar tomato laga do, kuch laga do. And one thing I learned during my own school days, if my mother will put them in small boxes, 2 carrot rak diya, ek aadha chota amla kaat ke rak diya, ek orange ko peel karke rak diya. If you give them the full orange, they tend not to, nahi hame ab kaun chilega kaun. So there are ways to kind of persuade them by helping. So parents can play and caretakers can play a big role in changing the habits of the children. And the kitchen gardens, if you can involve the children in growing the vegetables at home. They love flowers, but they also, so I grow herbs. I have basil at home, I have mint at home, I have curry patta at home. So when they smell them, they feel it. They pick it up. Choti narangi hai, kuch hai. So when they pick it up and they play around with it, and they also like to taste. Children are very curious about it. So this is one way of cultivating, inculcating these nice habits among children from the beginning are very useful. Even in a flat, I'm not living in a big house. So gamle mein thoda chote cheezein laga do, uski khushboo hai. Children see it and they grow it themselves, so they feel very proud of all these things. So just wanted to add that. Thank you.
Thank you so much, Ms. Rita, I mean, for giving those creative ways of, trying to include. Very well said, actually. You give somebody a whole orange versus you peel it and give even at least 2 or 3 and bits and pieces of a lot of things. I think it will go down easier than eating an entire orange. Thank you so much for those tips. Our next question is from Pepino Grover. If you could unmute yourself. And if you could just tell us where you're from. Pepino, are you here?
Yeah.
Yeah.
I hope I'm audible, ma'am.
Yeah.
Actually, I just wanted to know, like we have been talking about the virus, and we know like virus is something which is attacking all of us, but the ways where the virus can be weakened so that its impact is less on the human society. And because we know, like we are having cold also, that is also a viral disease, but we are not scared of it. But Corona has created the pandemic. So can we go for any way of going for the weakened impact of the virus through the diet, or like we have already talked about developing our immunity, but something of that sort which can help the entire society and the humanity? And I think I must have written something else, but that has gone on in the chat. And if you can read out what else I had written, that would help me.
Can I?
Yes, ma'am. Please go ahead.
Yes, ma'am.
Again, there is no magic bullet on this. I think if we want to make sure that we suppress the virus, then we have to follow the behavior.
Yeah.
Public gatherings, masking. Mask naam ke vaste mein jahan bhi jati hu, it is for name's sake. No, we have to make sure we are putting it properly and it's the right mask. Washing hands. We cannot suppress it by creating, as Anshu madam said, you don't create immunity overnight. Your immunity, it's not immunity. And this virus is not a virus like other viruses. This virus is still a mystery to everybody. So this virus is not something we said, okay, चलिए हम कुछ दे देंगे दवाई, flu के time injection ले लेंगे, कुछ हो जाएगा injection से, or antibiotic, whatever it is. So this is a very mysterious virus. So there is no kind of, again, magic medicine or something which we can suppress it. But the only way to suppress is not to spread it, and not to spread it means we try to follow the behavior. And that is one of the biggest challenge we are facing around the world, even among the educated people, because for last 2 years we are facing this and people are tired. Mask, I stay at home. I don't need to use the mask all the time because if I don't have people around me, but if you go out, people who do every day, I can understand the fatigue. But still we got to do it. Maybe this has become our life. I went to Japan. Everybody in Japan wear masks even in normal times because their trains are very crowded. They are out exposed to so many kind of viruses. So they try to protect themselves even in normal times. So maybe this has become our new normal. And we have so much of pollution in Delhi especially, or in many places in India. So there are things which maybe, as I said, blessing in disguise, that we may have to live with these things. Washing hands, very important, not going in public gathering. सबसे ज़्यादा मैं ये भी बोलना चाहती थी earlier, when you go to do any shopping in the shops, don't try to touch everything and stay close to everybody. And so this keeping distance is very, very important, which I don't see happening much because of our nature, our culture in India, or because there are too many people. So there is, even if you impose these rules, sometimes people have that habit of pushing each other in the buses and trains and all. So I think we have to really change the behavior. Unless we change that, I don't think so we can suppress this variant, virus that easy. Now it is Omicron, we don't know what is coming next. In Greece, they have Delta Cron now. Then we don't know another one will come because these viruses mutate themselves so fast. And of course, the blessing is the vaccination. So that is why even people who are vaccinated, they are getting it, but at least they are mild. They don't have to go to the hospital. And we have seen the data now. People who are in the hospital are then 80% of them are not even vaccinated. So we have to follow these kind of protocols, we can say, to protect ourselves and save the lives of people.
Thank you, ma'am. Actually, even I got this virus after getting vaccination twice, but yes, the impact was less. Yeah, thank you, ma'am.
Thank you so much, ma'am, for such a wonderful explanation. Also, I would like to take up next question from Uday. So I will be reading this out. In India, a vast number of people living below the poverty line, and they are heavily dependent on the public distribution system for food. And also we see a lot of malnutrition cases being witnessed on the family members of these classes. COVID-19 has added another layers of obstacles in the life of these families. These families are daily workers who does casual work. COVID-19 had affected and devastated their working style. So now they can ensure that they can get a balanced nutrients food. Also, we have seen the government food does not provide adequate balanced diet as per the calories required by the individuals. So I would like to direct this question to Ms. Urvashi.
Yeah, so I mean, I answered, I think, some elements of this earlier, but I'll just, reiterate. So yeah, definitely, I think, there are challenges that the pandemic has posed, but even without the pandemic, we have enough challenges, when it comes to malnutrition. And so, government, of course, like I said, there's many additional initiatives also that the government launched. In fact, once we had the onset of the pandemic, so for migrant workers, for instance, there is an attempt to create a one nation, one ration card, so that when a migrant worker is going from one state to another, they should still be able to access the ration and the PDS without any difficulty. So there are these kinds of initiatives that have been brought out. But like I said, for them to reach the last mile, for them to be truly effective, we need others to join in. We need, corporates. So, we talk of CSR. So CSR can also, for instance, play an important role here. We've already spoken of civil society. But CSR can also play an important role. It can be a force multiplier. Governments have to do this job, there's no doubt. But at this time, you need these force multipliers because the crisis is much more acute than in normal circumstances. So if we join in, all these resources, we pool in all these resources, it will be much more easier to reach people, at the last mile. And one other point on the actual, so it's one thing is your calorific sufficiency. So are you having enough calories? One is the actual composition of the food you're having, and I think that is a big shift that we anyway need to make, and efforts have started, but that's what we need to focus on. I think when we look at our country and its evolution, we started off where even getting enough calories for a lot of people, getting the bare minimum food also in terms of quantities was a big challenge, and that remains a challenge for many people, there's no doubt. But there are also a lot of people who might be eating enough, in terms of the actual calories, in terms of the quantities, but they might not be eating a balanced diet. They might not be eating a diversified diet. So the point that we increasingly now talk about, dietary diversification, this is very crucial. And I think this is where the government certainly, through Poshan Abhiyan, through its other initiatives, is trying to make this switch. We are trying to work very closely with the agriculture, ministry also. Otherwise, normally you see, nutrition works separately, agriculture works separately. We are trying to say we need to work with agriculture also to see that how can we promote this diversification in people's diets, where we are not just thinking about quantity, but we're actually thinking about the quality of what they are consuming. So I think a lot of these efforts are on. But right now, given that it's an acute situation, it's an emergency situation that much of the world has been grappling with, and so have we. We need these additional resources to also come in, in terms of CSR, in terms of civil society, volunteers, others, to make sure that the most marginalized, people, the most sort of underprivileged people are not, getting left out of the net. So I think that is what we need, in the immediate term, very, very strongly. But we need certain ongoing efforts, like I mentioned, on the dietary diversification and, other things like that. Yeah. Thank you.
Thank you so much, ma'am. Very well detailed with the question and answered. Okay, so we till now talked about how should children be taking care of their diet plans, how parents can help them go through, how the marginalized sections can find the dietary plans from their own local markets. Also, if we narrow down the line, there comes a very important aspect of how to improve the women nutritional status. Because if we talk about the women in remote areas, there are a lot of problems associated with nutrition aspects, to sanitation, to hygiene, to everything, which is somewhere more or less related in COVID times as well. It has added more layers, we can say, to the problems and infections, and it's booming the gap of infections with the hygiene issues women face in the remote areas. So what we can do to improve or just uplift the nutritional status of women, because women are the foundation, be they give birth to their child, to their family, to everybody. So Urvashi ma'am, would you like to take up this, if we can just address to this section?
Yeah, so again, women's health, nutrition, even without the pandemic, it's always been a very, very big challenge, and deep sort of inequities when we talk of women's access to services, how much they utilize services which might be available, but because of various reasons they might not actually be accessing those services. So this is, I think, a long-standing challenge. Again, one which has perhaps been exacerbated, because in the pandemic, we've seen that again, women might have suffered much more on several dimensions. I mean, a lot of that research is happening and data is coming out, but I think we can, it's safe to assume that women have suffered disproportionately on multiple counts. So I think definitely there is a need to intensify whatever programs we already have in place, which target women. These need to be intensified. These need to be, really implemented in a very focused manner. And whatever the losses we have made due to lockdown, due to the pandemic, we have to try and catch up on those losses. So whether we do it through door-to-door campaigns, whether we do it through camps, targeted camps in remote areas, we need to make sure that women who have been left out, of a lot of essential services, whether it's antenatal care or whether it's nutrition or vaccination or other types of services or screening for cancer, we're not speaking about non-communicable diseases, which is also such a big challenge, which has actually got more complicated because of the pandemic in some ways, because a lot of people have missed their screenings. So we need to have this very targeted approach, and we are trying to work on that with state governments to say that women who we might have not been able to reach out to during this time because we have been so focused on COVID, we have to reach out to them in a very focused way and provide those services. So that is one part of it. Again, we do need support of other stakeholders here also. That is very, very important. We also need to use the community groups themselves. You have self-help groups in so many areas which do very good work. So we have to try and leverage all those networks also to really combine with the government to address some of these issues in the immediate term. And then the awareness part, the social stigma part, the taboos, these have to also be continually addressed. It is not something new for those of us who work in public health. We are always aware of these challenges, but they need to be continually addressed, because no matter which disease comes up, we see more often than not the stigma is so much more for women, or the challenges are so much more for women. So these also need to be addressed. Like in many parts of the country, we saw some gaps in vaccination, COVID vaccination, when it came to gender. So we have been trying to, again, focus on those gaps and address those, and look at the particular district in the particular state where this is happening, and how we can come up with a localized solution. So more often than not, the solutions have to be localized. They have to be tailored, because there isn't just one reason for why women get left out or women suffer. The reasons can be quite different in different parts of the country. So it needs a targeted approach, and it needs a very focused approach, to make sure that those services that we have not been able to deliver, women who have been left out, we are able to bring them back into the ambit of the health system. So I think that is something that right now is a very, very big priority, and basically balancing the regular services that you need to provide with the COVID containment mitigation. I mean, this is very difficult to do. It's not easy to do, but that is the challenge that we have at hand. And that is what we are working on. And that is why I said that, if these other resources, as they have been, get combined with government efforts, we will get much better results. Yeah.
Thank you so much, Ms. Urvashi. I think Ms. Rita had a follow-up you wanted to add something?
Yeah, it was a follow-up on the previous one where Urvashi ma'am mentioned about the diet diversification. Yes, that is very important. That means fresh food items and a lot of, we talked about earlier. I just want to add, and Urvashi madam can confirm that government is this, somebody mentioned about the public distribution system. Yes, during the pandemic, government had added other items as well, like dal was there, and I think sugar or salt, but few other items. Just during the pandemic. But I just want to mention a big scheme which Modi ji has just launched is the fortification. So the rice which is being provided in the school meal program or even the PDS or the wheat flour, it will be fortified with the micronutrients. We talked about the vitamins and minerals. Because people tend to take supplements, those could be hazardous, those could be dangerous because you may take too much. We have a big issue with iron folic acid supplements because of the compilation, because they are not taking it properly, or they don't take it because of some after effects. So this fortification is a strategy which has been going on for many, many years. It's not new, but it's going to go very soon universal. So the people don't just get wheat flour or rice just as a staple for calories, but there will be some essential micronutrients like iron and B and zinc and whatever it is required. Same thing goes with the food given to the children through the Anganwadi centers in ICDS. It's not just only rice and dal mix, but it is also fortified with some micronutrients. So to make the diet more nutritious, there are many ways, which is fresh food items, diversification through kitchen gardens or whatever way, or through fortification. That's what I wanted to mention. On the women issue, it's not only again in India, but it's around the world. I work with an organization where we said the women eat last. We as women know, and I'm very proud to see all of us are women today talking about these issues. We know it's embedded in our culture. We are the ones who eat the last. First, give it to, of course, in many cultures, it's always the men first, but for us, it's the children, whichever way it is. So yes, women have been left behind during pandemic more than other times. There have been a lot of domestic violence during the pandemic. It was nice for being at home, but a lot of issues around that. We have seen this in among the people who come and work with us to help us at the household level. So there are a lot of other domestic issues as well. And as Urvashi madam mentioned, not only among the poorest of the poor, even among ourselves, we haven't gone to get ourselves checked for other things. Chronic diseases, like at my age, I would like to go for an annual checkup to do because I have osteoporosis or whatever it is. So a lot of these chronic issues have been left behind because of the pandemic, because hospitals have been overwhelmed with other services, and more so at the grassroots level, in the marginalized people in the tribal areas where, and I know, Alisa, maybe you were trying to talk about the girls, especially when they were going to school, they were getting during the periods, they were getting a package of the sanitary towels and all that. But when the schools were closed, and I kept on pleading to many of the schools, these things, while you are distributing the food, you can also distribute this, because this is necessary. So a lot of these things, I think a lot of lessons have been learned during the lockdowns, during this pandemic, and I'm sure these things, government will be looking into it, and NGOs and civil society, to make sure that these don't get repeated. And we will have more space and more ideas now, who should we work with and how we work with.
Thank you so much, Ms. Rita, for actually, enlightening us about the fortification program and stuff like that, because we probably don't really pay attention to these news as much. My last question would, I wanted to take one question. Ms. Anshu, you wanted to add something? Yeah.
Meta ma'am, I would like to add that it is very important that personally I feel that it is very important that the women be empowered and women be educated. So education can go a long way in women empowerment and for them to know what is right for them and go ahead and do it accordingly. So that is my
Yep. Yeah. Thank you so much. Yep. So one last question for the day today. I know there are still more questions coming on, but we had one last question from Anurag Mishra, and this has come up with some other people as well. You know, if there are certain vegetarians and, you know, who primarily rely on, say, dals for their source of proteins, and they end up being allergic to dals or nuts, what is the normal tendency is to switch to take, you know, supplements, right? So how do you recommend, like dal is a staple, right? What takes the place of a dal in somebody's diet, and to make up for, to compensate for that, you know, intake of protein?
So basically, I would like to add here that there are research present right now which suggests that vegetarian diet is better than a non-vegetarian diet for COVID-19 because non-vegetarian foods have shown to increase the inflammatory markers that are present. So, plant-based diet is being recommended for COVID-19. But if I really don't understand how can, I mean, is it that you're allergic to all the dals? You can be allergic to a particular variety of dal and you can avoid that. So if you're vegetarian, dals of course form a major component of your protein source, but you can also get your proteins from soya bean, you can get your proteins from milk and the various milk products like dahi, paneer, etc. You can also get a good amount of protein from the nuts and the oil seeds. So if you're eating almonds, if you're eating pistachios, or if you're eating, let's say, alsi seeds or some sunflower seeds, melon seeds, if you complement this into the diet, then you will be taking care of the protein. So I think if somebody is allergic to a particular dal, that particular dal can be avoided. But rest of the dals, chanas and lobia and kala chana, safed chana, rajmas, all these can be incorporated into the diet.
Thank you so much, Ms. Anshu. Anyway, Ms. Rita, you wanted to add something? I see the hand raised up.
Yeah, just what Anshu Madam said. Yes, you cannot be allergic to all the dals. We are so blessed with the types of dals we have in India, and India is one country for the vegetarians. Whenever I worked outside, they said, if you want to be vegetarian, go to India. So yes, that is one point. Another thing I would like to say, if you want to make even the dals, I'm not talking about allergy, more nutritious, it's always good to mix the dals, because some dals have some amino acids or protein and some have other. So we have learned that from our grandmothers, as you were talking about the nuskas. So we mix the dals, so that make it even more complete kind of a thing. Yes, a lot of people are allergic to like peanuts. I've seen that around the world, but they cannot be allergic to everything. I remember my grandmother's days, they used to have this watermelon, और उसका वो बीज सुखाते थे. Nowadays, we just throw it away because we don't have the time. So there are a lot of things I think we should go back to our traditional practices. Now the millets are coming up. I don't know if, I'm sure you are, as nutritionists, we are following it up because we have lost track of our traditional crops. The millets, the bajra, if we can mix them with wheat and the multigrain, whatever we call it, of course, so I think that a lot of these things we have to change our habits, because why our people were more healthy. Maybe they didn't live very long, but they were much healthier when they lived because they were eating very good food and at home, and all these nuskas were used. Some are not very good also, but at least the 90% of those should be encouraged, and we should bring it back into our culture and use it. So allergy, if somebody is allergic to somebody, as Anshu Madam said, okay, not all those, but then go to paneer or go to tofu, the soya. There are so many things one can go, because we can consume. There is so much a variety of food in India, which should not be a big problem. The problem is those who cannot afford, and the poorest of the poor, and that is the challenge. And as Urvashi Madam said, the government cannot be solving all the problems because the population is very big and the poverty is there. And so these are the issues which we should be taking into it. And our school meal program, as this is a school health session, I just want to say, I think as Urvashi Madam is here, I would like to see the school health, school meal programs to be more nutritious. Maybe it can be improved a little bit more than what it is. I think in Delhi, they are doing a very good, I have visited some of the schools, but in some of the areas, yes, it is not very diverse diet, which we are talking about. And that is where the kitchen gardens come. So we can always encourage children, seeing all that, they would be also going home and asking, demand will be there. If they eat something in school, which they don't eat at home, they can also tell their parents, we can grow this. So through schools, we can do a lot. Child-to-child program, and children can go and teach their own parents. In this pandemic, I understand children are much more, they are picked up so fast, this digital, so they can also reach out to their parents and educate them on a lot of things. And through this webinar, I'm sure a lot of young people can go back and tell your parents कि हमें ये भी सीखना चाहिए, ये भी करना चाहिए. So just wanted to add that as well. Thank you. Sorry, maybe I talked too much, but
no, thank you so much, Ms. Rita. I think that was a well round up to the session, and bringing the focus back on school health, school children, and our audience comprises of a very diverse set of people, from students to teachers to parents. So I think we have the right audience here, and I think you gave us a lot of good tips. And thanks to Ms. Anshu and Ms. Urvashi as well for shedding light on various aspects of the diet, public policy. Ms. Rita giving all her experience, all those years of experience coming in as a lot of valuable information for us. So thank you. I take this opportunity to thank all of you personally and on behalf of Sharp. And thanks to all the audience for being a very wonderful audience and vibrant audience with so many questions and so much chat going on. I'll let Aliza take it over from here.
Okay, I would firstly like to thank all of our panelists. You were very amazing, and I'm sure each one of us is taking something or the other home. And once again, I would like to thank the audience and the panelists. It was wonderful and very informative. Also, here comes the time to announce the sharpest winners. So Anurag and Pravesh, you win the vouchers, and our communication team will definitely contact you for further details. Can we have the feedback form? I would like to request the panelists as well as the audience to please take up the feedback form. It will be right on your screen. Certificates to all of the participants will be emailed within 2 days after the webinar. Please check your spam box in case you do not receive it, or write to us. We will get back to you at earliest. Thank you for attending today's webinar. If you find it interesting, you can subscribe for latest updates of our upcoming webinars and other interesting information on www.schoolindia.org.
And thank you, Alisa and Sunita ji, for inviting us. It was really inspiring for us as well to meet you guys, although it's very virtual. We'll get in touch with you.
Definitely. It was wonderful having you over, ma'am.
And nice meeting you, Anshu and Urvashi, although it's all virtual.
Same here, Rita ji. Thank you so much.
Thank you so much, Anshu, ma'am. It was wonderful having you as well. All the panelists were amazing.
Thank you, everybody.
Thank you.
Have a
Bye.
good weekend, and everybody stay safe and healthy.
Thank you so much, ma'am.
Thank you.
Very well organized.